Real talk. She's so cool and she rocks. DERLINE PIERRE, name is DERLINE PIERRE. Let's go. She's so cool and she rocks. She's so cool and she rocks. Real talk.
Welcome, welcome, welcome to Real Talk with DERLINE Pierre Louis. I am DERLINE Pierre Louis. And like I always say, without you, the audience, our supporters, we would have no show. It would just be me talking with myself, by myself, or I can invite a friend over and we have a glass of wine and talk. But I don't want to do that. I want you to be a part of this organization. I want you to be a part of this talk. So if you want to give us any feedback, or if you would like us to bring on any special guests, you just know what to do. You let us know and we will answer your call. You're watching Real Talk with DERLINE Pierre Louis. I have a special guest for you tonight, and we'll be right back so I can introduce my guest to you.
Real talk. She's so cool and she rocks. DERLINE PIERRE, name is DERLINE PIERRE. Let's go. She's so cool and she rocks. She's so cool and she rocks. Real talk.
All right. Welcome back to Real Talk with DERLINE Pierre Louis. I am DERLINE Pierre Louis. Do I have a treat for you tonight? Yes. You're probably watching during the day. You're probably on the radio listening to this, so you can't see my facial reactions and all the goofy stuff that we do here on Real Talk. But I have had the honor and the privilege to have some of the most phenomenal guests on this show. This show is called Real Talk for a reason. We are real, we're authentic, we're genuine. So, if we give you an opportunity to reach out to us, remember, at the end of the day, not only are we doctors, engineers, accountants, lawyers, but we are human beings, we are individuals, and we do have a life outside of work. So please be very respectful should my guest decide to share her call, her contact information, her email, or her social media platform, to not abuse it. You got it? All right. Are you ready? Are you ready? All right. So I am so excited. I met this phenomenal woman on one of my endeavors. You know, I love to go around the community, see what people are up to and what they're doing. And once we get to talking, you'll know who she is. But for now, I'm going to keep her a little secret until I mention her name. My guest is none other than Melodie Michel. Did I say that right?
You said it right.
Wow, welcome to Real Talk, Madame Melodie Michel. How are you?
Good. Thank you, darling, for having me on your show. I'm excited.
Are you excited?
I am excited.
This woman happens to be under the weather. Look how fabulous she looks. Don't you want to look this good when you're under the weather? But she's such a trooper. We've had this planned. She's like, nope, it's on my calendar. Christmas is coming. The holiday seasons are coming. I don't want to not end this year with our talk.
Of
so
course.
Thank you very much. I respect that.
You're welcome.
So let's have a real conversation. Cards are on the table.
Let's start. Let's get to business. All right.
So when I started talking to you a couple weeks ago, I realized, ooh, we have some fabulous divas in our community. I need to go out more often and get to meet these wonderful women. And on the spot, I said to you, I have a couple shows, but I'd really like you to be a guest on Real Talk. She's like, oh, what is that? I said, I had your husband on the show. She's like, oh, is that what? And then I solicited somebody else too, right?
You sure did. She rimmed me on into the show, right on there. And she did not forget.
No. I am a woman of my word. And if I say I'm going to do something for you, something has to happen drastically or beyond my control for me to not show up. So, and I think you're the same way because
I'm
sick
here.
or not, you're here. So I thank you.
You're welcome.
Tell
My
people
pleasure.
a little about you.
Okay. First and foremost, thank you for having me here. I'm a little nervous. This is my first time, as I mentioned.
No, but we're having a conversation. What are you nervous about?
I am here.
So if we had food here, would you be nervous? No.
No, I take a little.
It's all the lights and the cameras
Yeah.
and the glitz. See, I just turn all those off. All I see is you.
All right. So a little bit about myself. I'm Melody Michel. Born in the United States, raised in Port-au-Prince, Haiti, natif natal.
Vice versa. So you were born here and got shipped to Haiti.
Correct.
Oh my God.
Natif natal. My dad is from Okai, so I spent quite a few summers Okai,
Nice.
Fetchupet,
Okay.
as so many of you may know, mostly Port-à-Piment or Okai, Gelée. But however, most of my time was spent in Port-au-Prince. Grew up in Port-au-Prince. I went to a Catholic school like most Haitians do. And after that, due to political reasons, the plan was always for me to stay in Haiti, attend med school or anything science related.
Oh, wow.
That did not happen. I ended up moving up here for a political reason. As
When
I
did you
mentioned
come up
before.
here?
So I moved to the United States prior to moving
To Florida.
permanently. Correct. I always went back and forth during the summertime because I had family here. Permanently, I moved in 2004.
Okay.
04,
So you were born in the United States. Your parents took you back to Haiti because that's where the education is. I hear my
Correct.
mom say that all the time.
Correct.
If you want a very good education for your children, you need to go to Haiti. And now I hear her say, the Haiti that I once knew.
Well, yes. It's no longer the
It's no
same.
longer the
It's no
same.
longer the same. Yes, so I had the greatest opportunity to have a great
Yeah.
education, not just from the school system, but a village. I grew up with my grandparents that instilled so
Nice.
many values in me. I grew up with a lot of other family members from different background, different ethnicity, from the countryside, Dio, to Port-au-Prince, the capital. So different.
So you had both.
I had both.
That's awesome. That's awesome.
I middle class. My parents were, but I did have some family member that, of course, did not have the same opportunity that I have. So I was able to get both of the best.
taste of both.
Both, yes.
So you come here, what age you don't have to give your age, but what grade did you finish all your schooling in
So
Haiti?
yes, I did.
Okay.
I started applying to some university in Haiti. That's when some political
uprising.
uprising happened. So I decided, my parents mostly,
Oh, yeah.
and I
Agreed, came to a consensus.
came to because at that time I had a boyfriend, pretty stable. I did not want to
Oh
leave.
my God,
So-
yes, yes.
So I came here after philo. So moved up here, started school. I really knew that I wanted to be in the healthcare field. My mom, surprisingly, she wanted me to be a secrétaire because they had
Really?
this school in Haiti, a very prestige school, secrétariat, that when the ladies, it was an all-girls school, that when they finished that school, they'll work for the U.S. Embassy. They work for a very prestige.
She wanted the connection.
The
Okay,
connection.
I got that.
I was not that girl.
You were into your science.
I
yeah.
was either, honestly, in school, especially when they called that premier elementary, I was all engineering. I was
Oh,
always
wow.
math. I was engineering or architect.
Okay.
I did figure out earlier on in life, maybe in high school, that it'll take a lot for me to
Yeah,
to
the
maintain
engineer.
And I was like, well, in science or healthcare field, I will always have a plate on the table to eat.
Yeah,
So-
you'll always have food.
Correct. So that's where it all begins. I move up here. Granted, when I moved, I said, okay, I'm gonna do biology, but I did not know what I wanted to do, to be honest with you.
And I'm glad you say that because we put so much pressure on our youth at 13, 14, 15, 16. It used to be at 18 to 24 when you go to college. Now they're starting at elementary age because they have all these specialties in all these different schools. So you finished philo, you came here. Philo is what, you're 18, 17, 18?
18.
18. we're supposed to know what we want to do for the rest of our lives at 18, right?
Not really, but at least you should have somewhat an idea.
Yeah.
Like I knew, okay, the healthcare field. Was it nursing? Was it medicine? Was it pharmacy? Was it biotechnology?
But something to do with health.
Something to do with
Which
health.
is good.
Something to do with numbers. Anything to deter me from literature.
Okay. You didn't like to read?
No,
No memorization, no history buff.
No, I did not
Okay.
like that. It was always a struggle for me, even growing up in school. Languages, no. It was just, give me my math, give me my physics, give me my chemistry.
Because that makes sense.
And, yeah.
1 plus 1 is always going to be 2.
Correct.
No matter if you put sideways, upside down, in a circle.
Correct. Even if I have to figure out sugar and water, still gonna give me sugar. It just makes sense.
It just makes sense.
Yes.
I get it. Okay.
Um,
So you came here. Did you go to straight into college, university?
I came here. It was in the midst of the summer school, so I did not start doing fall. I started spring semester.
Okay.
So I worked for a little bit. As most people know, you get a little job, Burger King, McDonald's. So I've been there, done that. But ultimately, I always knew that my goal was to go to school. So
This was
even
a
when-
stepping stone.
Correct.
To take you from point A to point B.
Correct.
You weren't planning on trying to be a
No.
manager at McDonald's.
No,
Burger King.
and I made it very clear. They probably did not know because, of course, at that point, I had a very, very strong accent. You know, English was not my forte. I was just struggling. I was like, it does not matter.
And
Science.
you can't even tell now.
No.
huh?
And I'm like, science is the one love language. It
Yes.
does not matter
And
if
math.
it's French and
And
math.
math,
It
yes.
does not matter. It's the same thing. So
Yeah.
I may be struggling right now, but I know the books. I'm not going to struggle in the books.
So you went to college, you got your degree, and what?
So, so do you want the stepstone to where I'm at
Hey,
now?
this is your story. This is your story.
So I went to college. I started biology. Then I
Switch.
switched. Stayed in science. Still switched to biotechnology.
Okay.
Of course, thinking because I'm always watching CSI. I'm a big fan of CSI. Criminal Minds. I was
Forensic
like,
psychology.
forensics.
That's my
I was
thing.
like, okay, maybe I can get. Oh, I was fast to know. Okay, this is not it.
What was the point that said, ooh, this is not it?
No, so I did took a forensic class itself, and within that, the teacher was one of the forensic scientists. And when I'm talking to them, I said, "Well, how easy it is? Because you're teaching, you're not really like in the show. How easy it is to get a job? Little did I know it's not that easy.
It's not that easy.
So I was like, okay,
You
well,
have to be creme de la creme,
Creme
and
de
then
la-
you got to be connected.
I was like, okay, I'm out. This is it for me. This ain't it, right? So then I decided to volunteer at a hospital in the state that I was, and I
Ooh,
said, okay.
I like that. Okay,
Yeah.
I'm going to interrupt a little bit. A lot of times, us black people, and I say that because I'm black and I know us black people to the best of my ability, we don't feel like we should give our time for free to learn something. Because through your volunteerism is how you really know what direction you really wanted to go, right?
Correct. So I knew I could not get a job into the hospital because I did not have experience. So my experience was,
Yes.
okay, I'm going to volunteer. I'm going to work
Yes.
hard. You need me Monday
Yes.
to Friday, I'll be there, even
Yes.
if it's for 2-3 hours. So I
Yes.
was there. Within a couple of months, one of the supervisors approached me and asked me if I wanted a job because I had the skills
Do you see
already.
that?
Yeah.
You're seen, you're in their face, you're present, versus if you
Correct.
just gave a resume. I don't care how bedazzled that resume was, they don't know who you are.
Exactly.
But every day you're showing up 2-3 hours a day, you're
Correct.
doing your work, your
Correct.
character is speaking for you, your mannerism speaking for you, your knowledge is speaking for you.
Correct. Yes.
Look at you.
And I made sure, I was like, I don't want to volunteer at the gift shop. I want to volunteer either, on the nursing floor, somewhere where I had access to patient care.
Yes.
So I'm able to talk to the people, talk to
Yes.
nurses, talk to the physician, or any other member of the healthcare field. So
Okay.
I have a direct contact.
Nice.
So,
So you knew you had some direction as to where you wanted to be. You weren't sure exactly which line in the healthcare
Correct.
industry.
So
Okay.
finishing up my undergrad, I still finished up in biotechnology. I was like, okay, I'm pharmacy, nursing, public health, PA, physician assistant. Okay, I I knew medicine wasn't it, because
Yeah.
I'm like, I did 4 years, another 4 years, another 4 years, another. It's
12 years and then internship.
Exactly. No, this ain't it either. So I was able to early on start scratching some.
Yeah, you're doing process of elimination.
Exactly.
You're looking at the time, you're looking at the work that needs to go into it. You're like, am I still gonna love this a year, 2 years, 5 years from that?
Correct.
Okay.
But volunteering in the hospital, I did have some love for oncology and psychiatry.
Ooh. Okay.
So anything in that realm, I wanted to be exposed
Okay.
to. So for some odd reason, they placed me in the pharmacy department. I was like, okay, yeah, let's see this.
Yeah,
this is
this is
different.
new. Exactly.
This is new. I'm exposed to some of those medicine and labs. Let's see. Let's give it a try. And sure enough, fair enough, I give it a
found your
try.
passion.
And I did find, okay, I can do this. Okay, I don't have to be on patient bedside. I don't have to deal with blood. And there's so many opportunity that pharmacy offers that
Like what?
so to me being a pharmacist was just okay, you work in retail, you work at Walgreens, you work at CVS, you work at Walmart. I knew there were hospital pharmacists, but I did not know to what extent their job is. So being exposed to working in a hospital pharmacy exposed me to, wow, pharmacists are actually the middleman between the patient and the physician and the nurse. So I was like, I like this. I do a
Yes.
lot of clinical work.
Yes.
I'm able to just put my input. I'm able
Yes.
to make decisions. The physician trusts you. The patient
Yes.
trusts you. The nurse trusts you. Okay,
Yes.
there's a huge trust here, you know.
I love that you're saying that. You're almost like an advocate, because if the doctor prescribes this medication and you see the patient's record, they're already on this medication, you know this contradicts this one, so you can say,
Correct.
Doc, these two don't match. Maybe we need to change the dosage or this. I love
Exactly.
that.
I was like, wow, I can do a lot of
Power.
stuff. Yes, you know. And I also I knew that I wanted to have a family. So I wanted to have a career in healthcare, but that also provided me the opportunity to raise kids and to be a wife and to also serve my community. So I wanted not a work-life balance, but something that can fit within my dreams and my goal and my
Of course.
aspirations. So pharmacy was it.
All right.
I work in every department in the pharmacy, from NICU to surgery to oncology, and the main pharmacy, of course. I could not deal with NICU.
Oh, babies.
No,
Oh.
I love my own. However, it is very stressful, and you have to be very meticulous. And I just did not like seeing the babies there,
Suffering.
even though I love the fact that we can take care of them, we make them feel better, but I did not like it. People will say, well, oncology, people are not doing well, but there's something different.
They're older. They're an adult.
They're an adult. It's just, it was not the
And
same
they can tell you
feeling.
pain. They can tell you, when you give me this dosage, I feel better. When you give me this
Exactly.
one, the baby can't tell you anything.
Exactly.
Oh my God!
No.
So your heart was breaking.
Yeah, so I was like, okay, this not it. Right? So then after that, I started working. I worked full time while still going to school.
Nice.
Then I was like, okay, well, I guess it's time for me to apply. So I decided to apply to pharmacy school, and I knew I wanted to go to HBCU.
Oh, excuse me. All right.
So I applied to most of the HBCU, and I knew that I wanted to go to Florida. So I was praying God.
So where were you living before you came to Florida?
I was in Georgia.
Georgia. Okay,
Georgia.
I have family up in Georgia.
Yeah.
Okay.
So I wanted to come back home, so
Okay.
I applied to FAMU, and yes, I am a rattler.
What is it, the sign you guys do?
So I went to FAMU, loved it. Loved the school, loved
The
the
environment,
spirit, the
yeah.
environment, the support, the growth.
Nice.
I thought I was a woman living in Georgia by myself, working, juggling so many hats. I did not knew until I went to FAMU.
Okay.
There was such a growth. Learning the survival skill, I would say,
Yes,
the world
yes,
survival skills,
yes.
and how I knew I was different going to undergrad, but I didn't know how different it was for me to be in the world. And they taught me that.
Oh.
They taught me how to navigate the world as a brown skinned girl. They told me how to network, how to find my ways.
Nice.
So that was amazing.
Well, I'm glad you had such a great experience, because a lot of times, I tell people this all the time, college is not for everyone.
No.
But if you have the opportunity to go to college, go. But when you go, always visit the schools first. And don't only visit them when they're having their open enrollment, because they're going to put on the best show for you. So when my kids were going to college, we visited the schools off season. So when you do that, you're paying out of your pocket versus when the school invites you. So both of my boys play sport. So when they invite them, they pay for their fare, their hotel, whatever, and their food. Of course, I have to pay for my own because the schools won't allow that, which I'm okay with. So I let them go through that path, and then I go outside of that to see how the school really is. So you had a great experience. I'm so happy for you.
I did.
Okay. So now we graduate college.
We graduated college. While in college, even though I had hospital experience, I did not want to go back to the hospital.
Okay.
So I decided, okay, I'm going to work retail for a little while. So one day it won't kill me.
Yeah.
It was fine because I was in Tallahassee. And the store where I was working it was a busy store, but it was a different population.
Okay.
So I did not feel the retail experience per se.
Okay.
But I knew I was not going to survive retail because
Okay.
I'm like, I cannot see myself pregnant on my feet for 12 hours,
Ooh.
carrying a baby. No, this is not it.
Okay, so you're in college, you graduate. While you're in college, you did retail.
I did retail. So I was an intern for 4 years, actually.
Okay, nice.
Even got a job contract after graduation.
Look at that.
But I did apply for a residency because I know the main experience I had was being a hospital pharmacist.
Okay.
So I applied for a residency. I did get a residency because I did really aspire to become either a psychiatry pharmacist or oncologist pharmacist.
Oh, look at you.
So one or the other. So I wanted to focus in a hospital that offered best of both worlds.
Okay.
So that's where I was. They call it PGY1 pharmacy residency, which it's considered a general pharmacy residency where
So you get an overview of every aspect of every department.
You go to the ER, you go to the NICU,
and we already know you didn't like the NICU.
Exactly. You do internal medicine, oncology, and so forth.
Okay. So when we come back, we will let everybody know what department you really decided to stick with. And did you go retail or did you go back to the hospital? We'll get the gist and the juice.
Right.
And then we'll talk about your family, because I keep hearing, I wanted to be a mother and a wife. I wanted a job that's going to help me, allow me the freedom to balance that. So you're watching Real Talk with DERLINE PIERRE LOUIS. My guest is none other than Melodie Michel. Did I say that right? I like the way it sounds. We'll be right back.
Real talk. She's so cool, and she rocks. Italian Piaury, name is Italian Piaury. Let's go. She's so cool, and she rocks. She's so cool.
Welcome back to Real Talk with DERLINE PIERRE LOUIS. I am DERLINE PIERRE LOUIS. And as you already know, I bring on the most fabulous guests. Yes, I do. Tonight's guest is none other than I was going to say it backwards. Melodie Michel. I was going to say Michelle Melodie. But it's Melodie Michel. And she already explained to us her traverse. She was born here, went to Haiti, got all her schooling done up to philo. Then she came back to the United States where she's She was a United States citizen and finished her college degree. Now we're fast forwarding to her choosing a residency and determining which one of these areas of psychology medicine or oncology medicine or NICU. We already know she doesn't like NICU. So Michelle, tell us. So who did you choose? What department did you choose?
So residency is not for the faint of heart. I'll tell you that.
It's work.
Especially if you're at a level 1 trauma.
Ooh.
So
you got all these accident victims coming in and
all of them. It's
Whew.
I can tell you, I remember, I think I was only off maybe 4 days during the month.
wow.
So but it was a great experience. I thought I learned a lot in school. I did not really learn pharmacy until I was in a residency.
That's what I try to tell people. You go to school, they give you the technical terms, and you had the privilege of doing 4 years of internship.
Correct.
So you were learning from the book and learning hands-on. But when you're put into the mix of everything, that's when you really know what you know.
Correct. So given that I volunteer, I work in the hospital,
Yes.
so I had a advantage over a lot of students.
Yes.
I had exposures.
Yeah.
I already knew the medication names. So when I was studying, the medication name was not hard for me to learn. It was just really the text, the pharmacology part of it. So life was a little easier for me in pharmacy. So I gotta say this. And I will go back to the pharmacist and say, hey, what's going on with this? Can you explain this? So I had
you had an edge.
a hedge over.
So give me a second. Look into your camera. Let a young person or even an adult who wants to go back to school and wants to learn whatever it is, tell them how important it is while they're learning the textbook format. Why is it important for them to do the practicum hands-on as well?
Why is it important? Because it really not just put a perspective of what you're learning, but it closes the gap. It closed the gap as far as, I'm speaking for me as a pharmacist. I knew this medication is for blood pressure. I knew the name of the medication, but if I did not have the experience, I would not have known that this was for blood pressure. So I've seen it, I label it with patient name, but I didn't know what it was for.
Okay.
But then now going to school and now having the experience, knowing it, delivering it to the floor, delivering to the physician, or having a physician call, I need this now. And now I'm in pharmacy, this is why I didn't need it for. So it closes the gap. Having the experience, even my advice to any young or any adult changing career or heading to a new career or starting a new career, it's don't think about an internship that have to be paid.
Yes.
I think just the exposure and your willingness to volunteer, your willingness to learn hands-on on the job will take you very far.
Because you got a job at the hospital after volunteering.
Correct. It takes you very, very, very far.
Very far.
The opportunity, the network, it exposes you to a lot of networking. It also help you find something in you that you didn't know.
I like that.
Because, as I said, I was exposed to various departments in the pharmacy department that I didn't know existed.
And you're able to hone in on what you didn't want. We know is NICU.
Exactly. And what I wanted. And it also helped me to know what kind of pharmacist I wanted to be.
Ooh.
Because there's some I was like, oh no, that's not me. You know? So it helped me find myself in my career in what I wanted to be as a pharmacist.
I like that. So you didn't have to waste too much time getting a job. You didn't like the job because you're working in NICU or you're working in oncology, but that's what you specialized in without even having the hands-on, the chaotic. You worked in trauma. You're like, oh, this is not for me because I had 4 days off in 1 month. So you were able to do process of elimination, but not just because, oh, this is hard work, I'm lazy, I don't want to do it. It was because you were there. You worked it. You saw how it made you feel and how you didn't want to feel. And you thought about futuristically, I want to be married. I want to have children. Am I going to be able to handle the stress of NICU or trauma and go home and be present For myself, for my children, for my spouse.
Correct.
I like that. Look at you.
So fast forward.
Yes.
I know you want to know where
I'm
I'm at.
nosy, okay? Tell me the juice.
So I completed my residency December. We started in July, end of July. While you're studying your residency, you have to study for the board.
That's what I was going to say. I didn't hear the board part.
Oh no, you
Oh, my
start
goodness.
residency, you study for the board.
Oh my God.
I was like, well, because the residency, they give you a deadline. You have 90 days to pass the board or
Ooh, you're out.
You're out. So I was like, okay, well, this is it. I got to pass the board. So I passed the board, started, and then in December, they have something called mid-year where all pharmacists around the world meet. It's,
Ooh, that's cool.
right? So that's where you go. That's where a lot of people find job. They
Yeah.
find careers.
Because you're connecting with other pharmacists.
Correct. It's not just for retail pharmacists. It's hospital
everybody.
pharmacists.
Every single pharmacy.
single specialty
Ooh.
in pharmacy.
Ooh, I like that. So then you might discover other specialties that you didn't know about.
Correct.
Nice.
Every little niche of pharmacy
like
is
that.
there at that meeting,
Okay.
that yearly meeting.
Okay.
And that's at the yearly meeting. They're like, okay, what's your plan? Are you doing
Yeah.
a second year? I was like, well, I don't know, because I'm already married at that point.
Okay. No
I
children yet?
No, I got
Okay.
married in pharmacy school.
Okay.
I was like, I don't know if I can do a second year of this.
What would be the purpose of doing a second year?
So the second year, that's when I'll do a subspecialty. So at that point, I'm a clinical pharmacist, hospital pharmacist, and at that point, I will become either a psychiatrist pharmacist or oncologist pharmacist.
Okay.
Oncology pharmacist. And I decided against it.
Okay.
I got a job offer, full-time job offer with a hospital, which the hospital was also a specialty hospital
Nice.
for rehab.
So
it
you
was
would
very
get
different.
specialty.
Correct.
Nice.
And my level of expertise, having worked in trauma, having worked in the critical floor,
Yes.
so the rehab where I was working, it was a critical rehab. So
Nice.
meaning that a lot of the patients that would come were heart transplants. They were very critical patients, heart
Okay.
transplant, oncology patients.
Okay.
So I had the best of both worlds.
Yes. Without doing another year of residency.
Correct.
Okay.
Now, I'm always looking for opportunity. I'm always volunteering again.
Well, you know why? There's something in you. You have this drive and this desire to be a better version of yourself.
Correct.
I usually tell people, I have no competition. The only competition I have is the Darlene today, like this one. I don't have a clock. If it's 7:05, I want to be a better version of Darlene that was 7 o'clock. And if you're always striving to be a better version of yourself, you're going to volunteer your time. You're going to not just get involved in the community, but you're going to be updating your education in your industry. So that way you make sure you're doing good by yourself, but also you're doing good by those people you're providing medication to.
Correct.
So that's what it is in you. All right. So you volunteering where now?
So that was not a free volunteering, but that was paid.
But that's fine. Hey, not all volunteering has to be free.
Correct. So
You've done your share of free volunteering.
Right. So it wasn't really volunteering, but lack of a better word, I'll say volunteer because they were just opening a new department for the entire system, which is
Okay.
called home infusion.
Okay.
And they needed a pharmacist. So I was
Okay.
like, okay, well, I'm up
Brand
for it.
new. Look
Let's
at you.
go. Let's
I'll be
go.
the guinea pig. Use
I'll be
me.
the So I actually fell in love.
Oh my
so,
God.
So home infusion is the best of both worlds. So
Okay.
a lot of exposure to the hospital pharmacist because you have to know the critical side,
Yes.
the IV medication, the have an understanding of deep understanding of the inpatient pharmacist,
Okay.
Which is the hospital pharmacist, and also an understanding of the retail pharmacist.
Okay, so
Best of both worlds.
look at you. You're right in the middle.
Right in the middle. And best part, it has 1 or 2 shifts, but manageable shifts.
Ooh.
So it's not 24
you can
hours.
have your kids and your family.
Exactly.
Yes.
And I don't have to stand on my feet.
Okay.
So best of both worlds. So I am a home infusion pharmacist.
Okay.
I've enjoyed it. what I've enjoyed the most out of it is being able to educate the patient.
That's what I was going to ask you. So home infusion, you're speaking your language. So
I'm
explain
getting
to
there.
us, layman people who are not in the medical field, what does that mean? Because see, I'm thinking home infusion.
So-
I'm thinking home, and I'm thinking infusion. Like
It is exactly what you're thinking
okay,
about.
so that's my thinking.
So-
But some of our audience probably don't know what we're talking
So
about.
home
explain that.
infusion is exactly what it sounds like.
Okay.
You are at home
Uh-huh.
and you are receiving medication.
Okay.
It's not the regular tablet, but it's the IV medication.
IV medication.
So a lot of the patient, which is a very niche and unique specialty
Mm-hmm.
because we have a lot of patient that requires home therapy, home
Okay.
IV more
Okay.
specifically, so intravenously
Intravenous, mhm.
therapy at home.
Okay.
Some of those patients are continuous medication,
Oh, so
so
it's on
24
24
hours.
Wow.
So, for example, some patient that are waiting for a heart transplant,
Or
they are
kidney, uh-huh.
or kidney transplant, and I won't even say kidney because I don't even work with kidney patient. There's another niche
Oh wow, just for
pharmacy
kidney.
that just for kidneys.
That is so cool.
Um,
See, I'm learning so much. I hope you all are learning as much as I'm learning, or even more.
Yeah, so they actually just that's all they do is for kidney patients.
So that way they can hone in and specialize on
Correct.
every little
Kidney.
because there's variations
Correct.
of kidney. Okay.
Correct.
Oh my God.
For my part, my specialty is mostly cardiac patients. So
Okay.
patients awaiting
Heart transplant.
transplants. I did a lot of patients that have stomach issue. I'm
Okay.
using layman term now.
Okay,
so
please use layman term. Gastrology. What you're gonna go gastro
So
something?
patients that are unable to eat that needs to
Yeah.
receive
Their
therapy
nutrition.
via nutrition via
IV.
intravenously.
Okay.
I deal with a lot of patients that have infection that requires therapy longer than their hospital stay
Okay.
instead of 2-3 days. Or
So are you making home visits?
I personally don't
Don't.
make home
But
visits.
you
However,
set it up.
we have nurses that we work with. We work, so it's a team. It's not just me
Okay.
as a pharmacist. We
Okay.
work collaboratively with a team. So we work with the case manager in the hospital.
Okay.
We work with the physician in the hospital. We work
Okay.
with the nurses that
So you guys
are
have the
going in
meetings,
home.
you know, I'm going back to my Grey's Anatomy days. You guys have your little powwow meeting and talk about how if you're going to move this person from this medication to that medication.
So because I'm not inpatient anymore and I don't
Oh,
work
okay.
for the
Hospital
hospital
specific,
system
uh-huh.
anymore. But previously when I did work for the
You had
hospital,
that.
we had that meeting.
Yeah, I
But-
like to see those meetings, but I'm like, oh, they're really thinking about us. And
Yes.
I like, throw on some drug here. And
So now, even though I don't work for the hospital, I still have a very good idea of how the hospital
Because you
and
worked
patient, because
there.
I've worked there.
You've had plenty of experience.
Correct. So I'm able to explain to the physician. Some of them are not really familiar with how
Yeah.
home infusion works.
Yeah.
Even some of the case manager, they think, oh, the physician writes this order, let's just set it out. And no, it's not that
Someone
simple.
has to go and administer it. And
Someone has to go. So the nursing part is not that difficult.
Mm-hmm.
What is the most difficult is that we don't deliver on a daily basis to those patients.
oh.
So we deliver every week to those patients and
Okay.
sometime every other week.
Okay, so they have to have enough to sustain them if they're on a 24-hour.
Correct. Not
Okay.
just that. And if it's antibiotics that they have to take 2 or 3 times a day,
Ooh.
we also have to make sure that they have refrigerator to
I
keep
was
the
gonna say,
medication.
yeah.
Their home is appropriate to receive home infusion. They
So who does that? The
qualify.
case manager?
The case manager along with the nursing.
Nurses.
So
Okay.
prior to qualifying the patient, nurses also call the patient, ask those pertinent questions.
Questions, yeah.
Then from there we determine, okay, if the doctor write this prescription, is it stable enough to be in the home setting?
Okay.
So various questions, but it's very niche. There's a lot of subspecialty, immunodeficiency specialties,
Oh, wow.
immunoglobulin deficiencies.
So you found your niche,
Correct.
and I'm so glad you did. Now you were married while you're in school. Tell me about the babies. Tell me about the babies.
So the babies came a couple of years later, and I
Okay.
think that's one of the reasons why I left the hospital system
Yeah.
as well. because at that point we were still required to work quite a few holidays, and I have babies. I want to spend Christmas with my family.
Yes, of course.
So I wanted a job that I can have a work-life balance.
Yes, that's my thing.
Correct.
Work-life balance.
Flexibility.
At the end of the day, you are a woman. You need to have your time to pamper yourself, go shopping and do you. And then you got to be the wife, and then you got to be the mother. Not necessarily in those orders, but I'm just saying,
yes.
The work-life balance. Yes, you went to school for all these years. You did your volunteerism, paid and unpaid. You went through all these different findings to find what your true passion, what your true heart calling was. And now that you found it, you have the husband, you have the kids. You want to be able to enjoy that time with them.
Correct.
So how do you juggle the work-life balance?
To be honest with you, I don't even know myself. Okay. It happens. I do find time to be a wife. I find time to be a pharmacist. Mm-hmm. I find time to be a mother.
And a friend.
And a friend.
And a sister.
And a sister.
And a daughter.
And a daughter, you name
all
it.
All the different hats that we wear.
Hats. And most recently, another hat that I'm carrying. But I find time, and I also find time for myself.
Good, because I keep telling everyone, when people say I don't have time, I say technically you do, because we're all gifted 24 hours. Rich, poor, black, white, homeless, mansion owner, the president, everybody's on an equal footing 24 hours. How you allocate your time,
it's a different
I've done a show on telling people, look at your 24 hours, actually write it down from 5 o'clock when you get up to 10, 11 o'clock, 12 o'clock, whatever. Do you really sleep 6 to 8 hours? Some people are only 4 hours. Are you okay with that 4 hours? I think there was a study that was done. For every 1 hour that you sleep before midnight, it's equivalent to like 2 hours of sleep. So if you don't have 8 hours to sleep because you have such a packed day, maybe go to sleep at 10 o'clock, because 10 to midnight gives you 4 hours. Then you get up at 6 o'clock. There goes your 8 hours right
Correct.
there,
So from growing up, I always, I guess it's one of the qualities that I say I had is I'm a very organized multitasker.
Okay.
So I've held many hats even prior to being married and being a doctor, not just from volunteering, being a student, but I was also a leader in various organizations. I participate also volunteer in the community. So I juggle all of that. So it's just a matter of adding on more stuff. And I'm able to manage those tasks and figure out, okay, that's why I was like, darling, we're getting this done today. You're on my calendar. After that, this is the reason. After today,
I like that.
This is mommy time. This is the
Exactly,
holidays. This is Christmas time. And I want, and that's something that I've done for the last couple of years, is allocating myself myself to my family for the holidays, because the rest of the year anyone can pull me left and right and I can figure out how it is for my kids.
But they're also out of school, there's downtime.
Exactly.
So I like that.
So during the holidays, my favorite time of the year, I do give it to my family.
So are you a doctor?
So I am a doctor of pharmacy.
Okay, well, I need you to listen. This sounded like a lot of hard work, so I need to hear Dr. Melodie Michel. So go ahead, get your kudos. Look at the camera and introduce yourself to everybody. You are
Dr. Melodie Michel.
Yes, own it.
Yes.
You work hard for it.
Yes,
you
I
just
did.
told us all the hard work while being married, while juggling a family, while volunteering and doing internship and residency. Should I keep going on?
Oh, yeah. And it goes on and on and on and on.
One thing I'm going to say that I admire about you when I first met you, I walked into your husband. We didn't even talk about him. I told you it wasn't about him, right? We walked into his newly open clinic, and it was the grand opening. No, ribbon cutting.
Yes.
I don't know if you had it. Grand opening, ribbon cutting. So you did both of
them.
Okay. And so you were just there, and I'm like, I bet you that's her, because I had interviewed him, and he was talking about it. So I'm like, I bet you that's her. But the way you were greeting everybody was on equal footing. Everybody was respected. Everybody was just, you made everybody feel so invited and welcome, and I like that. And that's what we need in any and every industry. And the fact that you honored our time, even though you're under the weather, doesn't she look great for being under the weather? So I want to say thank you so very much. And you and I are going to be doing some stuff in the community because we already talked about it.
Yes.
So you'll allocate some time and I'll allocate some time and we'll find out where our time can meet. And so we can give back because we've been blessed, we've been gifted to having the opportunity and the platform. And a lot of times we don't use it. But I want to say thank you so very much for honoring our time and for coming here and being a guest on Real Talk. So one last thing before we go look into your camera. Say your name again, doctor, and then tell people if you do want to mentor, if you have time. You remember my disclaimer, letting people know, yes, we're doctors, engineers, lawyers, or whatever, but at the end of the day, we are an individual, we're human, we have our life. So if you do want to offer that, by all means, look into your camera and do that.
I am Dr. Melodie Michel. I have mentored many students previously. However, as I mentioned, and I'm on Real Talk, I would love to mentor any student that wants to be dedicated to the mentorship that I'm providing, and also that have goals and aspiration and that are going to work hard to get there. Because I'm not here to babysit anyone.
You have your babies already.
Correct. And my time is very valuable and very precious. So if you want to do the work and you have goals and aspiration, I'm more than gladly.
How can they reach you? You want to give social media or what platform do you want to give? You can choose. If you're going to give your phone number, then you got to be ready for the calls. If it's social media, then at least social media, you can screen it. And then you can reach out further and exchange phone numbers. That's what I would suggest.
You can reach me out on social media. I'm on Instagram.
Okay.
I think it's RX Red Diva.
Oh.
Yes.
RX Red Diva. I like that.
And you can DM me and I will return the call. And if we'll talk, discuss, and we'll go from there.
So listen. I've had plenty of mentors and I still have mentors. Some of them I've paid to be mentored. So you are being given an opportunity to be mentored. You heard her story. It's not a fly-by-night. She worked hard. She was disciplined. She was structured. And while carrying on with her life, she's willing to give you a little of her time. Like I always say, my disclaimer is, respect her time, respect that she's an individual, respect that she has a family, respect that she has a job and a career. So if you are serious, like she said, and you would like this opportunity, it's been given to you. A lot of your college professors say you can call me after hours and so forth, but sometimes they won't be available to give you what she's going to give you because this is real talk and real life. So again, I want to thank you, Dr. Melodie Michel, for being on Real Talk with me.
Thank you so much for having me.
My pleasure. And everybody else, thank you so very much. Without you, we would not have a show. Have a great day on purpose.
Real talk. She